Hi, my name is Amy Scalise, and I am a graduate student at Roberts Wesleyan College. I will be describing my observation of a high-fidelity, interdisciplinary pediatric simulation with you. The interdisciplinary team involved nurses, residents, and pharmacy. All responded in the roles as they would in a real-life setting. Additionally, I'll be reflecting on the significance of this experience and talking about the benefits and future usefulness of simulation in my teaching. The simulation started with a review of the mannequin and the functionality of it. The leaders also went over the equipment that was present in the room and what was available to be used during the simulation. The simulation took place in a real patient room in the ICU that was currently not in use. The scenario I observed was that of a 4-year-old patient who was admitted to the hospital with probable asthma. He had a few-day history of respiratory symptoms, wheezing, and shortness of breath. When the nurse walked into the room, he was found to be unresponsive and not breathing. Of note, the nurse had been given a brief report on the patient, so she was familiar with him, much as she would be in a real-life setting. After walking into the room and performing a brief assessment, she initiated a pediatric code, and the remainder of the team responded. The high-fidelity mannequin was able to be connected to a defibrillator, which displayed a rhythm on the monitor. Vitals were able to be taken on the mannequin as well. CPR, rhythm interpretation, and defibrillation and medication administration were all completed throughout the short scenario. There were challenges with the equipment, identification of roles, and with closed-loop communication, much as there might be in a real-life code scenario. The challenges were all discussed in the debriefing. The debriefing took place after 10 minutes worth of the scenario. The discussion was facilitated by the nurse leader and the physician who ran the simulation. They started with asking someone to describe the scenario in a couple of sentences. This was met with some reluctance until a specific person was called upon to recall the details. Discussion opened up from there, and others joined in when prompted with questions, specifically what went well and what could be improved. At the end, each person was asked to recall their takeaway or one key point of what they learned from the simulation. Effectiveness of the experience. I think the simulation was effective for nurses and doctors and pharmacy, and many lessons were learned. The first was that it's hard to remember what to do when the stakes are high. Many expressed that even though they could articulate what to do in a code, actually practicing in a high-stress situation was different. Things like what medication to give on the provider end, or switching to who was manning the airway, which could not be switched in and out in a code. This is why it's so important to practice these scenarios ahead of time. There were some pre-simulation communication gaps that were brought to light during the scenario. For example, the first-year residents should be providing the compressions. Few people, doctors and nurses alike, realized that this was the assigned role, and during the simulation, this was mainly done by nurses. The facilitators realized that this needed to be communicated better to staff. Many of the staff left with skills that they wanted to practice after going to the simulation. Some examples included drawing up medications, a review of the pediatric advanced life support algorithm, and getting adequate chest rise with ventilation, which was a struggle during the simulation. Other talking points came up during the debriefing that elicited the response, "I didn't know that." So these were not just things that people forgot because they were stressed, but these were new things that were learned. The debriefing seemed to be more of a learning experience than the simulation itself. Benefits and usefulness. Simulation allows nursing students to get hands-on experience and gain comfortability with assessment and handling equipment prior to having to do so on a real patient. In a clinical setting, they are considered to be the student nurse rather than the nurse, and they report any abnormal findings to the nurse who can help them troubleshoot or contact the appropriate person. In simulation, they have the opportunity to actually be the nurse, and they are in charge of handling patient problems and addressing abnormal findings. Simulation also gives nurses and nursing students the opportunity to practice psychomotor skills that they either haven't used yet or don't use with much frequency. For a student, this might be placing a peripheral IV or a Foley catheter. For a practicing nurse, this might be providing chest compressions, bagging a patient, or drawing up and pushing emergency medications. With an interdisciplinary simulation, it can be helpful for doctors and nurses to see where they fit into an emergency situation and what they feel comfortable doing. When a real-life critical situation occurs, these people have familiarity with their roles. Simulation can be useful for both practicing nurses and nursing students to play out scenarios that they may not see on a regular basis. When a patient does decompensate in real life, they can act quickly because they've seen this before and they know what to do. I will certainly use simulation in my future teaching, whether that be with an undergraduate nursing students or practicing nurses. Especially for the high-stakes, high-stress patient situations, it can be helpful to have the hands-on time when mistakes can be made without patient harm. For practicing nurses, this may be a scenario like what I experienced during my observation. For students, this might be a sick patient who simply needs extra time and medical intervention, a patient that they might not have the opportunity to assume full responsibility of in a clinical setting. I think in both cases, these simulations help with critical thinking and build confidence for times when they need it the most. Thank you.